Hi guys, this is Courtney Butler Robinson, and this is my yoga therapy channel and intentional living channel. And if you like my videos, I would ask you to please look below and click subscribe and a thumbs up if this content is helpful for you. That helps get more people to my channel and spread the word. So I want to talk to you today about yoga for cancer, and this is definitely a brief synopsis of yoga for cancer. It's obviously in 10 minutes. I can't get all of the information to you, but I want to talk a little bit about what yoga for cancer looks like and what a yoga therapist does. And I'm going to speak as if I'm speaking to the yoga therapist, but please know that this is beneficial for anyone who has cancer or is dealing with a loved one with cancer and finding a good yoga therapist. So my work is, I'm a yoga therapist. I was independent for years. I'm still somewhat independent. I'm a contractor. I work for the Dr. Dean Ornish Reversal Clinic, which focuses on heart disease. However, this program has also been shown to be very effective with breast cancer, prostate cancer, and gastrointestinal cancers. So I'm going to share with you today some things that we do and work with. I work with people privately with cancer in my home and outside of my office, but I hope that that may actually be changing soon. In the office, we often see people who have cancer and some kind of cardiovascular issue going on, so they are approved for both. And well, they're approved for cardiovascular, but the benefit of the program for the cancer is there as well. So let's talk about some main things to think about. And I had to make notes for this because it's a lot and I didn't want to forget. First of all, when you are taking on a client with cancer, there's some things that you need to learn and know. Number one, you need to have an intake, whether it's a group or an individual. If it's a small group, there needs to be an intake for each person. Understanding what's going on with that person, what type of cancer they have, any surgical sites, where they are in their treatment and recovery plan. That is going to depend on what you're going to do and how you're going to modify the practice for each person. So it's very important that you have a good understanding. I would encourage active listening and watching very carefully, not to be judgmental. So if you haven't, you can take a class on active listening. I'm sure there's tons of information online. I also went through a coaching program, solution-focused coaching, to help me know how to guide people. So let's talk a little bit about what that looks like. That might look like active listening. A client says to me, I'm just so frustrated with my family. Everybody's giving me advice and telling me what they think they should do, and I just feel incredibly irritated. I would say, so what I hear you saying is you're really feeling frustrated and irritated with people telling you how you should feel or how you're supposed to be handling this. Is that right? They would say yes, and they might go on. So I wouldn't say, well, have you tried this? Have you done that? Have you done this? I would avoid any judgment. On the coaching, it taught me to ask questions like, what are your goals here with me today? Or why are you here today? Tell me a little bit about what your expectation is. That helps me set up a treatment plan for them. The other things I might ask are, tell me who your supporters are, what's working, what's not working. And then I would ask supportive questions like, are you in a support group for this? And that way I kind of lead them on a little journey of self-discovery. Now, if you don't have coaching training or you're not a therapist, you might not know how to do that. But I would encourage, if you're going to work in the field of yoga therapy, some kind of training in active listening and coaching as well. All right, when you get right on into working with people who have cancer, what you need to know is no two people are the same. I have a son with autism, and what we often say is if you've seen one person with autism, you've seen one person with autism. It's the same with cancer. There are many types of cancer, and there are many treatments for cancer. So one person may be going through surgery, another through radiation, and another doing a pill form of chemo. The impact or effects, side effects of those are all very different. So if a person is dealing with nausea, then that might be different than a person who's dealing with surgical pain or inflammation around a surgical site or trouble with drainage. So you need to know what you're dealing with. So asking the proper questions and applying the proper breath work, asana or posture and meditation for whatever's going on with your client. We want to also think about scheduling around treatment. Sometimes within the first couple of days of having a treatment, there's going to be a lot more side effects. And so you need to be prepared to schedule around those. Maybe they would have their session with you prior to treatment, or like a lot of them will get monthly treatment or weekly treatment. A lot of people going through treatment. So you wouldn't want to probably schedule right after treatment. You want to think about different things like lymph congestion. That's a very important part of treating people who have cancer. When we don't move enough, our lymph system has to be moved to not become congested. So I go through a series of joint movements that are very good in hitting into the lymph glands and the lymph chains. So I use a lot of Mukunda Styles work in yoga therapy. And that's a really gentle practice, just going through and moving every joint, the neck, the shoulders, the elbows, the wrists, the fingers, the spinal column, the hips, the knees, the ankles, the feet. And so what that does is if you focus on those, it really helps with lymph congestion. The other thing I focus on a lot is working on pressing of the sternum to hit underneath. Oh my goodness, my mind is blanking out. I'll think of it in a minute. The endocrine area here that's under the sternum to help with, it assists in T cell production, and it assists in white blood cell production. So we want to work a lot on pressing through to the sternum to assist the endocrine system. Now, the thymus, my goodness, my brain, the thymus. So if it's available, so for someone who has breast cancer, I would probably put them on a pillow for a modified fish, not only to support in the thymus, which is responsible for helping to make T cells and white blood cells, but also for lymph drainage under the armpit. Every type of cancer, again, is going to be different, but that would still be beneficial as well for someone with prostate cancer because they're still going to need the white cell production. Now, you've got to be mindful of surgical sites like ports and things like that. Someone with a port might not feel comfortable going down on their hands for a down dog, or there might be, or to feel upside down. So it's important, I can't say it enough, to ask lots of questions and find out everything you can. You don't want to do anything that's going to raise the stress level. And we're going to talk about that lastly in just a moment. So the breath work, number one, needs to be calming and to help induce a relaxation response. The asana it's not that more fitness types of yoga can't be helpful for exercise when it's appropriate. But when you're talking about yoga in the healthcare field for cancer, cardiac, when people are sick, what we specifically want to focus on is creating a response in the body that creates a parasympathetic response. And so I guess this is a good time to get into that. So I try really hard in my job. That's my job. My job is to get people in a parasympathetic response. And I'm going to create their asana, pranayama, and meditation to get them in that parasympathetic response using tools like the breath work, proper breath work, like alternate nostril breathing, 2-part and 3-part breathing. Asana is going to be gentle and not stimulating. It's going to have specific reasons that we do it. Number one, lymph congestion, making sure we hit things like the adrenals and the thymus, creating a relaxation response where the body goes into a parasympathetic state or a relaxed state. When the body is in a sympathetic state, the blood volume is going to the extremities. The adrenaline and cortisol is rising. The eyes dilate. And this causes the body to be in that hyper alert, vigilant state, which is good when you have to lift a car off of someone in a car wreck. But it's not good when the body stays in that state. We are not meant to stay in a sympathetic response. When we stay in a sympathetic response, it's like a garden that just grows rocks. The environment of that soil is not good for anything. The environment in our body, when we stay in a sympathetic response with the high level of cortisol, is not healthy. It creates a lot of inflammation in the body. We as yoga therapists are training people to get their body in a parasympathetic response or relaxation response. This is the rest and digest. This is where the body creates, like a garden, good soil. So the environment in the body then is healthier and it can be set up now to heal. All right, so that's very important. It's like having good soil. When we are practicing these different visualization, things like visualizing what you're thankful for and seeing it in your mind releases oxytocin. That's a bonding hormone. When we smile or think about things that make us happy, that creates dopamine in the body, which helps reduce pain as well. These different practices up our good hormones that are healthy, and it's not that any hormones are bad, they just need to be balanced. So they up our dopamine, they up our serotonin and our oxytocin, and these create a healthier response in our body. When we stay in a stress state, we create cortisol. By training people through asana, pranayama, and meditation, using things like visualization and imagery, positive thinking, these different techniques, what happens is their mind literally gets, the gray matter literally gets thicker, and they are able to see, and you can look that up, you guys. There's lots of, it's in the Harvard, I believe it's the Harvard did the studies on this. There's a lot of studies now. You can look on ornish.com under research and see all of the stuff I'm telling you. So what happens when you meditate, your mind becomes able to observe, okay, I'm getting stressed out. I need to start breathing. I need to close my eyes and go to that place of peace and joy in my mind. I need to do these practices I've been taught. That's going to help them deal with the stress of cancer and create a healing environment in the body. That's all the time I have, you guys. Please subscribe to my channel. If you would like to speak to me directly, just go to balanceyogaandwellness.com or Google my name. Thank you.